When we do that, we are doing surrogacy. Now, there has to be reason. There has to be reason as to why the original biological mother cannot carry her baby. There has to be reason. So we have to evaluate, are you having healthy issues? Is your womb okay, or it has issues? And so if we judge for this reason that you can't carry the pregnancy, and then somebody can carry for you. So it's possible to do that, but it has to be assessed
first by the medics.
Yes.
Okay.
Yep.
Thank you so much for the responses. Grace, wherever you are, I think the doctor has given you back your feedback. Please, before you do or decide anything, seek for medical help from a specialized personnel, so they can make for your timetable, plan for you, assess you, and they see whether what you want to do is possible. And then for the little child, the doctor has been so clear. I think it could be genetical, or is still growing, or still you can go to the clinics or to the hospital, or you can visit Bethany Hospital itself. It will give you a better answer to that. She's saying, thanks Teacher Zita for the show. What causes sperms not to have tails, and how can it be prevented, doctor?
Yes, so the report, as we said, analysis of the sperm is usually a detailed analysis which involves counting the density of the sperms, the population of the sperms, but also studying their shape, including the different parts, the size, the shape of the head, the presence, absence of the tail, the shape of the tail, yes, and their movement as well. Now, problems of the sperm, especially structure, like the one she's describing, is absence of the tails, is a structural problem. Now, these problems usually arise from the development process of the sperm. And the development of the sperm goes through extensive stages, several stages. We describe a number of them now, but at some stage, the sperm has to develop the tail. If that stage is interfered with, either because of some diseases or because of some enzyme issues, somebody is born up without the certain enzymes, then the sperms will not be able to form the tail. And we know at what stage we say sperm formation is being arrested. Yeah, or sometimes if the sperm from the process is released before it develops the tail. So these are technical issues with sperm development. Yes, so structural issues with the sperm usually reflect abnormalities resulting from the formation process. Okay. Yeah.
Thank you so much.
But it needs, if you have a few sperms without tails, that may not matter. Okay. It needs to be more than 40% of the sperm without tail. That's when you become of concern. Okay. Yep.
Thank you so much. We have another message coming in. I was inquiring, at what age or months can a baby be operated in case of undescended testicle? Thank you. This is a parent, I think, inquiring. Yes, though she didn't give us our name. Just in case you're giving us a feedback or inquiring, please tell us where you're calling from or where you're sending your messages from. For those of you who could have missed the number, it is 0786 050 762, and then we shall be able to get all your feedback. We have many messages coming in, but let's first answer that maybe.
Yep.
Yes, he wants some undescended testicle. Can it be operated, and at what age?
Yes, so undescended testicle should be operated as soon as possible. It must be moved down into the scrotum as soon as it is noticed. But there are those few cases where it's as a result of delay in the movement, which is a normal delay in the movement. So because of that, they move by themselves after a few months. So within about 2-3 months, you should be able to see the testicles appearing. So we usually recommend that within 3 to 6 months, we should be able to do that operation.
Okay.
Yeah.
Thank you so much. I think you've got the feedback. Calls are also open. You can call on 0786 050 762. It's still Medical Minds. Doctor, another question here from Jackie. She's saying, I have all my tubes blocked, doctor. Which medical solutions do you give me?
Yeah, blocked tubes, both tubes blocked. As I described before, we have to assess where the position blockage is and what extent the blockage is. Sometimes we can correct them, but sometimes we don't have to correct them. We do IVF. Okay. And of course, we also have to consider other factors, because if somebody is very young, maybe he's about 25, 30 years, and the blockage is not too much, then you have more reason to do the unblocking.
Okay.
But if somebody is maybe 35 and beyond, and there is some blockage, now you see you'll need more time for them to try after unblocking. So it becomes more logical to be more radical, and you go for things like IVF.
Thank you.
Yes.
Jackie, I'm sure you've got your feedback from doctor.
So again, what I can say is that this discussion has to be face-to-face with the doctor. Yeah, a fertility specialist has to guide you on what the way forward is.
Okay.
Yes.
Thank you so much. Our next gentleman is saying, Kawoya from Nansana. I'm stuck. I've been trying to conceive with my wife for a year, but not married yet. But I don't see any change, and I think we might be having a problem. I've been treating, is it cystitis?
Cystitis.
I think
cystitis. That's a bladder infection.
Oh, maybe the way he has written it. The doctor says that the doctors say, but I didn't see any change in me. While I have any hope.
Will I have any hope?
Will I have any hope? I think maybe that's what he meant. Yes.
Yeah. So.
Doctor, before you respond, there is a call online. Caller, hello, Bethan TV.
Hello.
Hello, caller. Where are you calling from? Kale mama nawe gye baliko. Ye mama. Ani akuba essimu tubulireko ku mannya go. Bitura? Yes, mama.
Sumaya.
Oluganda lwogere tujja dutegeera mpola.
Kakati nina muzukulu wakatugire ku nsonga muzukulu wange yali 13 mulezi.
Okay.
Yazaalibwa linnomo nga kakati wegayimirira n'ebibekiwa nagenda okulaba kutuusa emyaka nga 7-8 awo nekagwamu amaanyi gayimirira nga bukagwa kayimirira naye nga kikakyayimirira ate n'ensula ze zaterera kutono nnyo.
Okay.
Kakati awo kwezentya musawo.
Kale nyabo naye tweyanziza nnyo omusawo kakuddemu. She's saying she has a 12-year-old grandchild.
Yes.
I think the testicles are maybe, I think they're shrinked, something like that.
Yeah.
They started when I think the child was 7 to 8 years. But for now, sometimes, it is very normal for a male child to wake up in the morning, to erect when they wake up in the morning, especially morning time. But this child does not erect at all. What could be the problem? Is there any hope for that child?
Yeah, so of course that is a concern. 12-year-old is a little bit young for you to conclude about the erection behavior.
Because she's saying it started 7 to 8 years when he was around that time.
Yeah, so for the evaluation of the erectile function, I think she really needs that child needs the doctor to assess. Again, also for the testicles, if they are small and they are shrinking, these are some of the cases of where somebody had maybe mumps before. And so maybe there could be still an opportunity to rescue her or him, to rescue him. And so I think this needs a proper assessment and a more urgent one.
Okay.
Yeah, we have to, she has to take that child to the hospital for evaluation.
Thank you.
Could be the nearest hospital and find a doctor to examine the child properly.
Okay.
So that this is sorted out as soon as possible.
Thank you so much.
Yeah.
Kakati mama yonna gy'oli omusawo agambye osobola okufuna obudde n'ogenda mu ddwaliro n'olaba omusawo omwana ono ne bamukebera asobola okufuna obujjanjabi as soon as possible ku myaka gye gy'aliko. Ayinza okuba yalwala amambuluga nga muto oba yafuna ekizibu nga temwakirabirawo naye akyalina essuubi nti nno omwana we tukyasobola omuyamba basobola omuyamba mu ddwaliro. Weebale nnyo okkuba essimu. Doctor, we have other questions before we went to respond to the calls. We had a message from viewers. He's saying, "Hello, Dr. Underbat. Thanks so much for the show. It is good to. Is it good to do SHG? Is it HSG the second time after 2 years if the first one showed one blocked tube?" Can there be changes in the blocked tube over time? Can the radiation affect me because I did the test already? This is Chisache.
Okay. Yes, that's a good. Those are good questions.